when you're talking that it's just a small number of people, why don't we want to protect ourselves from a disease? As I stated earlier, 54% of our children in this country have a chronic illness that lasts their entire lifetime, is disabling. They cannot leave their house. Some of them can't talk. Some of them are wearing diapers at 20 years old and wearing helmets and smearing their feces all over the wall. That, to me, I'd rather have measles for a week and know that I can treat it, because it's not 1945 anymore. We can treat measles with vitamin A, low sunlight, good nutrition, hydration. We have hospitals, we have quarantine, we have antibiotics, we have all sorts of great things that can treat infections now. We have sanitation, we have clean running water. We don't defecate where we eat anymore. It's not the same as it used to be in the early 1800s when children were dying of measles, when we had them working in mines 18 hours a day before the child labor laws took effect, and they weren't getting access to sunlight or proper nutrition or proper hydration. Yeah, they were killing kids back then. It's a lot different now. I would take a week of measles any day over what I'm watching some of these families experience in my daily life. Measles is not deadly in the United States. We have not had a child die from measles in a long time. And the last child that died of measles in the state was he wasn't even a child, he was a 21-year-old immunocompromised person who had received a bone marrow transplant 18 months prior and had the vaccine. So we're not talking about an emergency here. With all due respect, I understand and respect the legislators' concern to protect public health. This just isn't the avenue. This seems to be opening up a market for profitability rather than protecting public health, because it is not in the interest of public health. Measles is not a deadly infection in the United States. And when we are exposed to it, there is zero scientific data to support the rabbi's claims that 90% of unvaccinated people who are exposed will catch measles. That's simply unsupported. And we have the data to prove that experiencing reactions from the measles vaccine, please read, I printed this out, it's 1,500 pages. And I'm happy to share this with any of you. I printed it out at my own expense. There is tons of data in here to state that the vaccines that we are trying to mandate on these children are causing way more harm than is good. The data is catching up to us with what we've done, and it's alarming. I have legal proof, I have scientific proof that is accepted in courts of law by judges all over the United States that this is a problem, and that the legislator, while I do respect their concern, may not be understanding the full ramifications of their intentions.
Thank you very much. Are there any other questions?